Hi everyone, I'm Tina, team member at Miraculous Medical Supplies Inc. And as we promised, a series of IV supplies. This is series 1, and we are going to educate you on IV supplies today. So the first thing what you're going to need to have, sterile 2x2s, and you're going to need alcohol and sterile alcohol pads. You're going to need to have IV sterile normal saline for flushing the IV catheter after you gain entrance into the body. IV tubing. Okay, there's different types of IV tubing. I don't get more into detail with that. Okay, you're going to need an IV start kit, and this is a really handy duty weight product here because this contains everything that you need to start your IV. It has a tourniquet, which includes the vein. It has the alcohol. It has the sterile dressing to cover the catheter afterwards. It has tape, gauze, really good supply, what you need. This is a female lure lock, and it actually has a filter on it. And also here's another female lure lock, but this one is more for puncturing with a needle, where this one is a needleless system. IV tubing. So then we go to the different types of IV catheters that there are. Well, the smallest we have is a 24 gauge. This is a pediatric size for more small veins. And this one also has the wings, so it's easy at an angle to help guide it in. And what's also nice about the wings is how you can anchor the tape. You can put the tape under and then crisscross it. Helps it kind of prevent it from the IV catheter from falling out. We got a little bit more economical one here. It's a 22 gauge. It does not have the wings for the anchoring, but this 22 gauge is really good for just IV fluids and antibiotics primarily. The 20 gauge is actually, it's a little bit bigger of a gauge needle, but the 20 gauge, they come in wings also, and this one is the more economic one without the wings. The 20 gauge is necessary if you want to give blood products, if you're going to need to receive blood products. The 18 gauge is for people that are going to need blood products and rapid fluid replacement. If they're a trauma patient and they need a lot of blood products, a lot of fluids to maintain your blood pressure, and 18 gauge is really good for that. And also, they even go to as a 16 gauge and a 14. Then we can go to the butterflies. Well, the butterflies are more for people that have small veins, or patients that are more fearful of the bigger catheters. The butterflies, we call them butterflies, and they have these little wings, and these are much better. They're easier for the patient, and it's easier for the nurse or the phlebotomist or whoever's putting it in. It gives them more of an ergonomic position, easier, more effective, and also these are for like veins that are closer to the surface. Where the IV catheter, the longer ones, the longer catheters, these are more for deep veins, and these are more for superficial veins, the butterfly ones. Also, like with these other IV catheters that are more for the deeper ones, the catheter itself stays in the patient, and these can go for about 72 hours. Here in the United States, we usually change them about 3 days or monitor them if there's any inflammation at the vein site, or depending on how tough the patient is as IV access. And the butterflies, there is no catheter, so it's just the needle, and the needle does go in and stays in. They can be for blood draws, and they can also be for IV fluid, giving fluids to the patient or antibiotic use. They're about 3/4 of an inch in length. They come in various sizes. 25 gauge, 27 gauge is the smallest. 23 gauge is really good for blood draws. A 22 gauge is a little bit bigger, and then a 21 gauge, and they also have 19 gauge. So they also are color coded. This one actually is a 25 gauge for pediatric, and it has the tubing is 12 inches long, so it can actually attach the IV fluids to this catheter here, to the female lower lock. They're color coded, so sometimes the orange is pediatric, but it depends also on the brand. Some of them also, like the 25 gauge, are also blue, so it depends on the manufacturer. 21 gauge is usually green. The 19 gauge is the more of a grayish color. Also, what you would need for after you get in your IV catheter, once you've accessed the IV catheter into the vein here, and you pull the needle out, you would attach this female lock. This is an extension tubing. This is needleless system. The nurses love this because the less we deal with needles, the safer we are. You can just put a clean cap on it, you know, one of these sterile caps, and then take it off when you use it, wipe it with alcohol, and then flush it. And we have another small bore here. They come in various sizes, and this is an extension set as well. Very important, the biohazard box. Needleless system. Nurses out there, remember not to recap your needles. Use ones that have the safety protection on them. And tune in for series 2 on blood draws. See ya. If you like this video, just make sure you subscribe, hit the bell, subscribe, and let us know if you want to see any more about IV supplies. Or if you have any questions, give us a call at 786-701-8843. We're always here to help you. Our staff is very highly trained and professional. We definitely care and want to help you understand what products you need. Okay. See you then.